Okay, so welcome everyone. It's a pleasure to have you here tonight. I'm Judy with Hope Dementia Ministry. Our topic for today is Dementia Basics. So what I want to go through is the very basic, it's really like the most frequently asked questions that people have about the topic, the whole topic of dementia. And we'll try to cover, all different kinds of things that give people more language for talking about it and ideas what to do about it if you think you have an issue or if a loved one that you know has something going on, and what the first steps would be to take if that is your situation. But before I start talking about what dementia is, I want to mention a little bit about what dementia isn't, because some people tuning in might be concerned about that they think they have something going on, or they're pretty sure that their loved one has an issue. But sometimes the things that really cause people a lot of stress are things that are more related to lack of focus. So when we think about the term multitasking, everyone feels like they're a great multitasker. They can have a phone conversation and drive, or do something else at the same time. But really the brain can only focus on one thing. So if you have had a time where you walk into a room and you can't remember what you're there for, if you forget a word while you're in conversation with someone, those kinds of things sort of make people uncomfortable. But the truth is that they're more related to lack of focus than they are to dementia. Let me just give you an example. So if I am intent on something, the mail came in, I need a stapler, I'm in my kitchen, I walk up the stairs to my office to get the stapler, and on the way up, I notice a piece of lint or something on the stairway. So I pick it up, and I notice as I pick that up, well, there's some cat hair in there too. And I'm like, oh, I need to vacuum the stairs. Oh, did I remember to order the vacuum cleaner bag? So I'm having all these very different thoughts on the way up the stairs to the office, that by the time I reach the office, I have no idea what I'm there for. And if that is something that you experience, that's probably not dementia. If you can backtrack, go back to where you started. And so I walk back into my kitchen. Oh, I see the papers there that I know needed to be stapled. I need to go up for the stapler. So that's not dementia. Also, if you're in conversation and, there's a word you're looking for, and what is that word that means all this that I'm talking about? And somebody says the word and you're like, yes, that's it. That's the word I'm looking for. That's not dementia either. That is maybe a slowing of your recall. But when we're thinking about people with dementia, they may walk into a room and not know what the room is for. They may lose a simple word like the word spoon, or remote control. And, then if you give them the word, it's like, well, that's not really a familiar word to them either. That is a situation where you have the red flags. But this stuff that we go through on a daily basis is because we're busy. We're thinking about lots of different things, and we're trying to do too many things at the same time. So a way to alleviate some of that stress is by focusing more, thinking about very deliberately what you're doing, being mindful about what you're doing at the time. That can really help some of those things. As far as recall goes, it's a point of practicing. If you're using words that you don't use in your everyday language all the time, you know the words, but you don't use it all the time. If you're looking for a celebrity's name and you don't use it all the time, and maybe a day later or that evening or in your sleep, it comes to you, that's a sign that it's not dementia. But that being said, dementia, and you'll notice that I use the term dementia, I don't say Alzheimer's. Because dementia is an umbrella term. Dementia is not a disease in and of itself. It's a collection of symptoms that have to do with memory and judgment and figuring things out and personality changes. These are all symptoms under the dementia umbrella, but there are many, many kinds of diseases, many conditions under the dementia umbrella. And Alzheimer's is just one of those. it's the most prevalent one, and so that's why that word is used, you know, kind of interchangeably, or people might be confused about what's the difference between dementia and Alzheimer's. Well, that's what it is. Dementia is the umbrella term. It's the overall term for all these different conditions. Alzheimer's is the most prevalent type of dementia. So you can have dementia, but not have Alzheimer's. But if you have Alzheimer's, you do have a form of dementia. Okay, so I hope that clears that up. Now, dementia is not part of normal aging. It is, but the biggest risk factor is age. So it's not young people that are getting it, it's older people that are getting it, and typically over 65. And it's because there's a lot of things contributing to it that build up over the years, over your lifetime. So it could be poor lifestyle choices, it could be head injury, it could be environmental exposure, those kinds of things. That all adds up to creating issues in later life. But again, it's not part of normal aging. Our brains should be able to function normally into our 90s and even past 100. We might slow down a little bit, you know, our bodies slow down as well. We do lose brain cells throughout our lives, but we should have enough in normal aging circumstances to live out a very full life with all of our faculties. But looking at the epidemic that is building in our country, if we look at someone who is, say, age 65, 1 in 8 people of age 65 will develop dementia. By the time you go 10 more years to 75, 1 in 4 people have dementia. By the time we look at people who are 85 and over, it's typically half of that population has dementia. So it is, you know, age is the biggest risk factor. So a lot of people ask, when is dementia diagnosed? And typically the answer to that would be when a person has used up their brain reserve down to the last 20%. Now, it happens over a very long period of time. So early symptoms that we think show up when people are like 65 or 70 really probably started back when they might have even been in their 50s. But because the brain is an amazing organ, it can compensate. And we can follow certain paths as we're driving. We can go a certain way all the time. We can be not quite so adventurous and just do the same things over and over. We can write lots of notes, all these different kinds of things that kind of act as a crutch for our brain that can help us to really compensate if we are having symptoms early on and other people don't notice. We don't necessarily even notice until it becomes closer to that 20% of brain reserve. The reason it's diagnosed then is because it starts to interfere with our everyday living activities. It is where adult children start noticing, that was kind of odd. Our living partners will notice that that was a very strange thing that you just did. And so it's when it starts interfering with those everyday things, meaning things like cooking, dressing, maybe your clothes are on inside out or something like that. Those are some of the telltale signs that start to develop when you get beyond that 20% reserve. And that's where it is typically brought to the attention of doctors, and that's typically when it's diagnosed. Some people are very keen on it way before that, and they rather than denying it and saying everything's fine or not telling someone about it, they tend to be more proactive, and they understand that something is happening much earlier on. So some of the symptoms and warning signs, the most common thing that most people are familiar with is the progressive forgetfulness and the short-term memory loss. So short-term memory is the things that are happening on a daily basis. Our short-term memory is what we use when You know, we look at the calendar and we say, okay, these are our appointments today. So we keep that in our short-term memory during the day. Someone who starts to lose their short-term memory can't even remember for a few minutes what their appointments are for that day. They may start to ask the same question over and over because maybe they can't remember they asked the question, but maybe they also can't remember what the answer was. And so they have to keep asking to try to figure out what's going on. Another thing when we talk about progressive forgetfulness, so it might be someone's short-term memory that they lose those kinds of things about what the conversation just was, you know, and you might say, we just talked about that, and now you're asking me again. That's an example of short-term memory loss. But progressive forgetfulness is things like if someone was really big on sending birthday cards to the whole family and they really knew everybody's dates and things like that. So progressive forgetfulness is kind of forgetting what the date is, what the month is, where we are in the year. And so that starts impacting, they miss birthday cards, you know, if they're not looking at their calendar for clues. They never used to have to, but maybe they would need to start to. Maybe they don't have it written down because that's they've been relying on their memory only for that. So that's when you look at progressive forgetfulness, more and more things are being forgotten. And there's also a decline in reasoning skills. And this means something like keeping a checkbook, balancing a checkbook. A lot of people are going to online banking where they don't really keep that old-fashioned checkbook where you get your bank statement and you want it to all balance out perfectly. But I know the older generation does. My parents still do. My mom gets her checkbook out every month and she reconciles her checkbook. But for some people, that starts to become more difficult to do. Just the understanding of simple math of what do you add and what do you subtract. And so those reasoning skills, those basic reasoning skills start to become impaired. And if people are still working into their later years, they might find that there are issues on their job that start to be impaired before they really realize that something's wrong. There are certain things that they used to be able to do very easily, and they become not so easy for them to do anymore. And other things that are the common telltale signs are things like bill paying. If you paid a bill and then you forgot that you paid a bill, and so maybe you pay it again, and maybe you pay it a third time, but you don't pay something else, now you're getting shut-off orders, and this is often where adult children come into play. And you know, their parent gets upset because they've got a discontinue order, and what is that about? And then they start looking through things and they realize how many issues have been going on for quite some time. Another thing that takes reasoning skills is cooking. Some people use recipes faithfully, but a lot of people have their set dishes that they just know what goes into them and they know how to make them. So sometimes as the brain starts to deteriorate, people forget exactly what goes into that. What goes into my specialty dish? Or they make it and it's really terrible because they didn't put things in the right way, or they didn't bake it long enough, or whatever is that they're supposed to be doing. Other issues are like confusion in familiar places. One of the first parts of the brain to deteriorate is the hippocampus. And that is also where your spatial memory is. So sometimes people will feel disoriented in a place that should be very familiar, whether it is their neighborhood, their town, their grocery store. You know, they used to know where everything was. Now they're confused about where things are. That's a warning sign. And going outside dressed improperly, I mentioned that already. You know, sometimes we'll see people show up and their sweatshirt is on inside out. You see the tag. You know, there's some reasoning skill to when you're doing laundry, turning a garment right side out, and maybe that's not something, or maybe they just didn't notice that that was the situation. Other symptoms are things like a loss of the sense of smell. For some people, that's an early symptom, and it can be, you know, years and years before other memory type or other type more serious impairment comes along. And, you know, that's not to say that if you have no sense of smell, you have dementia. It could be caused from something else, but that's a common issue for a lot of people. And then there's the change in personality and behavior. And what a lot of that is when someone starts to feel disoriented, they don't feel like themselves. They don't feel comfortable. They might say the wrong thing, and people around them react poorly. And so they're, rather than being the outgoing regular person that they used to be, they might be more withdrawn, or they might be more irritable because people are correcting them all the time. So when you see some of these personality changes, that could be a sign that people are struggling with something internally. Swearing is another common early symptom. And all of us have heard swear words. A lot of us use swear words freely, but a lot of us don't. And even though we don't use them, we have heard them. Well, as the executive functioning part of the brain starts to break down, that's the thing that tells you what's appropriate to do and not to do, what's appropriate to say when and where, and, you know, how to go outside dressed and those kinds of things. But it also tells you what's appropriate to say in front of this person or that person. So if you are noticing that your loved one who never swears is swearing more freely, that could be a warning sign as well. Paranoia is another common symptom, especially with one of the types of dementia. We'll talk about that a little bit later on. But people starting to become afraid of what's happening, or they think someone is out to get them, or they think someone is stealing from them, or they start to have delusions and they start to believe things that are not really true. That's another symptom that comes along with it. And depression. Often depression is an underlying illness that can lead to dementia developing, but even someone who hasn't suffered from clinical depression can develop depression because as they start to know something's happening, they may withdraw. They may not be really proactive about saying, I know something's wrong, I want to check it out, I want to know what's happening to me. They may say, something's happening to me and I'm afraid. We're all afraid of a diagnosis of dementia. And most of us have heard about it now. Most of us know someone who has it. So there's a lot of fear that goes along with it. And people may self-isolate. And so when someone is isolated, they become lonely and depression sort of sets in. So that's something that can escalate dementia. And loss of temper. If someone has been very even-tempered, you know, all their lives, and suddenly, you know, they might snap at what seems like a very small thing, that could also be a symptom of this underlying insecurity issue that's going on because they're starting to understand something is not right. So let's look at the main types of dementia that we're talking about here. Alzheimer's, as I said, is the most prevalent type, like 50 to 70 or maybe even more % of the people who are diagnosed with dementia is of the Alzheimer's type. It's a slow and steady decline. It can take many, many years. I mean, from 8 to as many as 20, depending on the health of the person otherwise. And it's just, it's a slow and steady decline. If you were to look at a graph, it would just be a gradual declining line. Most people are diagnosed after the age of 65, but there is another type of Alzheimer's that is genetic based. They have isolated the gene that makes someone at more of a risk for this. And we call this early onset or younger onset Alzheimer's. And typically we find that being identified in people who might be in their 50s, definitely under 60. People who develop it 65 or over is the late onset. And it's the one that we look at as not being genetically identified, like it's not something you inherit, where the young onset is something that you can inherit. The vast majority of Alzheimer's disease that we see in society today is not inherited. It is something that we work our way into. And so that's something to be aware of. Another common type of dementia is called vascular dementia. And as you might imagine, it has to do with blood flow to the brain. When we think about heart disease and these kinds of things that have to do with veins and arteries and blood flow and oxygen levels, that is what's related to vascular dementia. So someone who has chronic heart disease might be suffering from strokes and things in the brain. So when the brain cells are deprived of oxygen, they die, and someone's cognition level can drop after a stroke to a lower level. So this is also a decline, but it's more of a plateau and a step, and a plateau and a step. So it's going down over the years, but it's more of a stair step kind of thing. So it's after an episode that one might notice the difference in the cognition level. People can have mixed dementias as well. So someone can have Alzheimer's and vascular dementia. They can have them together because they might have heart disease, they might have diabetes, which is most closely linked to Alzheimer's. And so they can have both different kinds of things attacking the brain at the same time. There's another interesting type of dementia. It's called dementia with Lewy bodies. It's been identified as different types of things in the brain. So, you know, when they do an autopsy on a brain, they might identify specific things as related to Alzheimer's or vascular dementia, where they can see that there have been strokes or something. And then this other type is dementia with Lewy bodies. So Dr. Lewy identified these other particular things in the brain, and that's how it got the name. But this one is quite different in a lot of ways. It doesn't start specifically with the memory loss or the short-term memory loss and memory issues. It starts more with the paranoia. This is the one that I said was, you know, paranoia is very prevalent. And it's more about reasoning. So like if you do something and it doesn't work properly, you can't figure out why. And you might do it over and over again, thinking it's got to work, because you just can't work through that reasoning process. And also the cognition, the deficits come and go. So if you know someone who seems really good one day and another day doesn't know you at all, and yet further down the road, they seem really good again, that's typically not Alzheimer's, that's dementia with Lewy bodies. And it can fluctuate day to day, but it can even fluctuate from hour to hour. So, you know, people tend to have times of day that are better, like morning when they're well rested, they seem to be more lucid. And as they get more tired toward evening, they might be more confused. But if you know someone who is really in and out of what seems like cognition hour to hour or day to day, that's probably pointing toward Lewy body dementia. And there's some other issues that come along with that. And one thing is visual hallucinations. So people see things that are not there, and they seem very real to them. A lot of times it's children. They might say, oh, look at the children sitting there playing. Or they might talk about the puppies or the kittens in the bed. And it can be very unnerving for a caregiver or a family member because they completely don't understand this. And so a lot of times people will try to prove to the person, there are no children there. Look, I'm walking here. There's nothing there. I can't see anything. There's nothing there. That's very disturbing for the person living with these hallucinations. And so it's really much better to try to go along with them and not correct them, and that's called being in their reality. It might seem difficult and it might seem like you're lying to them, but what it is you're trying to help them feel secure. And so rather than butting heads all the time or correcting them or fighting about it, you just kind of let those things go. Another issue that comes with the dementia with Lewy bodies is a REM sleep disorder. In REM sleep, which is where we dream, rapid eye movement, normally cognizant people are paralyzed while they're dreaming. That means that your body is paralyzed, your muscles don't move. If you have a dog and you notice when your dog is dreaming, they're just all over the place. They might even be barking and that kind of thing. So dogs don't have this. But people suffering from dementia with Lewy bodies also have this disorder where their body is not paralyzed. And so they can act out their dreams. Their dreams tend to be more violent, where their hallucinations are kind of warm and fuzzy. They're not scary, terrifying things, but their dreams tend to be more terrifying, and they act out their dreams. So they might get out of bed and they might pull the blankets off the bed, or they might hide in a corner, or they might try to protect their bed partner, but actually might end up injuring them. They can fall out of bed and hit their head on the nightstand. So it's a big issue for these people. And that's just one of those other symptoms that goes along with that one. Dementia with Lewy bodies is connected to another disease under the dementia umbrella, and that's Parkinson's. Parkinson's, if someone starts with Lewy body dementia, they develop Parkinson's type symptoms toward the end of their disease. People who start with Parkinson's disease, where they're having the muscle rigidity and the tremors and those kinds of things that go along with that, they often develop into the Lewy body, like the hallucinations and those kinds of things, toward the end of the Parkinson's disease. So it depends on which one they're diagnosed with primarily that it's typically called, but then they are connected on either end. We also have some kinds of conditions that we call reversible dementias, but it's because they mimic dementia type symptoms. Now remember, dementia is not a disease, and so the symptoms under the umbrella can manifest themselves in people who have, like, depression. We come back to depression. Someone who is clinically depressed can exhibit confusion and memory issues that people with dementia have. If their depression can be successfully treated, that might be improved. People with thyroid problems, extremely low vitamin D, extremely low vitamin B12, urinary tract infections, all of these different kinds of things can cause people to feel brain fog, to feel disoriented, to feel not like themselves. And sometimes when they're having these symptoms, they're afraid that it is one of the more progressive types of dementia, and they don't want to say anything about it. But the other side of that is, if it is an infection or some other kind of imbalance in the body that can be treated medically, then those symptoms can be cleared up. So it's really important, if you feel you are experiencing this, or if your loved one is having difficulties, it's really important to see your doctor. Start with your primary care doctor, get a good workup, get all kinds of blood tests, and don't be afraid to talk about the types of symptoms that you're having. Okay, so I want to move into the whole memory aspect. Memory is such an important issue in our lives, because we all know the phrase of, would you go back and change things? Well, no, everything that's happened to me makes me who I am. And so what that means is our memories, things that we've experienced, the things that we remember throughout our lives, makes us who we are. So we have this tremendous fear of, if I lose those memories, who will I be? I won't know who I am. Or I won't know who my loved one is. If they start to lose these memories, who will they be? But a person's essence is always still there. They may lose some of the memories that you share with them, but it doesn't mean that their whole being changes, that their person changes, or that they're gone. And so that's an important thing to remember. There are ways to continue to reach people throughout this whole process. And that we'll cover that in some of the other sessions. But for now, right now, I want to give you a kind of a visual for understanding memory, how memory is saved, and then how it is lost in the dementia issue. So I want you to think about, visualize a 5-drawer filing cabinet, you know, just a regular tall office file cabinet. Our first memories that we form when we're first born, maybe even before we're born, but the first memories of our life are filed in the bottom of this drawer in the back. And every memory that we make after that gets filled in front of that. Once we fill the bottom drawer, we go up to the next drawer from the bottom. And again, we fill from the back so that our life is filling up this file cabinet from the bottom. So that by the time we are 90, 100 years old, we've got that file cabinet filled right up to that top drawer. So when someone develops dementia, and especially one that is debilitating for the memory, the hippocampus specifically, and that's what Alzheimer's seems to attack first. The hippocampus is the memory center. And the first thing that happens is this short-term memory loss. People are not going to be able to remember what they had for breakfast or whether they had breakfast at all. But they can remember a lot that happened 40 years ago. Because what's happening is they cannot take any new memories and put them into the file cabinet. And then we lose memories from the top drawer down. That's why we experience our elders forgetting the names of their grandchildren. The names don't seem familiar. And then maybe they forget that they have grandchildren at all. And then maybe they start calling their sons and daughters by different names, maybe by their brothers and sisters' names. What's happening is they aren't forgetting their children, but they might be further back in this file cabinet. And for them, their children are little kids. So as they're going back and reliving their life or remembering their life, what's on the surface is farther back. So they don't understand that this 50 or 60-year-old man or woman is their son or daughter. They are thinking, you know, where are my kids? You know, I should be taking care of my little kids right now. People actually age back to the point of being children. And they have the same insecurities and issues that children have. We have a whole session coming up that's going to talk about how to deal with someone who's back in their memory. Because what we tend to want to do is remind them about reality. Remind them about the present. Come on, you can stay here. You know, I'm your daughter. Don't you remember me? And that's a big burden to put on someone, to tell them they have an adult daughter that they don't remember. That's very scary. So when we're thinking about and understanding memory, if they're talking about things that are happening way back, then we know they're going back through their file cabinet. And it's better just to converse with them and interact with them about whatever it is that they do remember, that they are talking about. Okay, so what if you or someone you know is identifying with some of this and you feel that something is wrong? What do you do next? Excuse me. So the first thing that you want to do is to keep a timeline. You want to write some things down. What has you worried? Is it because you're walking into a room and you don't remember things? Is it because you're forgetting people's names? Are you forgetting people that you see all the time, or are you forgetting people that you haven't seen in a long time? You need to put it down on paper. What is it that you're experiencing? What is worrying you? And then the first thing that you want to do is start with your primary care doctor. And most doctors now, as they're seeing elderly patients, so they see you once a year or every 6 months, they kind of do this mini mental status update where they're going to try to assess a baseline. And then every time they see you, they're going to see Are you on the same baseline? Have you slipped a little bit? Doctors are getting much better about doing that now. 10 years ago, that wasn't on everyone's radar. So we're better off now than we were 10 years ago. But if you still feel that there's something serious going on and your primary care doctor is dismissing it or not addressing it, or maybe you are the spouse and your spouse is putting on a pretty good show for the doctor, which they are able to do. People can really compensate when the time is necessary, and then they get back in the car and everything just falls apart and you're like, why couldn't you say that in there? So if you feel that you're not being taken seriously, if you have these things written down, that's a better idea for the doctor to go on about what's going on rather than just seeing what they're seeing right in front of them on that specific day. And you can always ask for a referral to a neurologist. Typically, a neurologist is the person who will diagnose some form of dementia. So a neurologist will do testing. They might do the same kind of testing that your primary care doctor does. They might ask you questions. They might ask you to remember some words. And a few minutes later, they will ask you to repeat those words. They might do some brain scans or, some of those kinds of things. And then they might come back to you and say, okay, we believe that you have dementia of the probable Alzheimer's type. You're not going to get a definitive answer because a definitive answer only comes from an autopsy of the brain after the person has passed away. So what you're going to get is this is probably what it is. And they're getting pretty good at deciding what type of dementia a person has because of the symptoms. If you go in saying, my loved one is seeing little children playing on the floor and they're flipping out of bed at night, well, then the doctor is going to, kind of look at dementia with Lewy bodies. If your loved one has had some strokes and has heart disease, then it's probably of the vascular type. And if your loved one has diabetes and some other things going on, and it's been a slow and steady decline, then they're probably pretty sure that it's of the Alzheimer's type. So being able to take more information to your doctor is a good thing. So then what do you do from there? First of all, if you receive a diagnosis of dementia or your loved one receives a diagnosis of dementia, the earlier you get that, the better. Because number one, you can make some decisions for the rest of your life if you are still cognizant enough to sign some papers and make some decisions. If you wait too long, if you're afraid and you don't want to go out and get it diagnosed and you don't want to face it and you're in denial, then you will very likely end up in a situation where you might have, your loved ones might have to go to court to decide what is going to be done with some things in your life. The sooner you can figure out that something's going on, also you might be able to get into some type of a study or a drug trial where you can take some experimental things that they're working on. They're working on new things all the time, but they need people to test those. And if we don't have people coming forward at an early enough stage, then they won't know if what they're testing can prevent the dementia from getting worse or can maybe even make it better. Once someone gets too far along, treatment is, even the experimental things, it just doesn't work. And right now there is no treatment. There is no cure. There's not even a treatment that can slow it down. But they're finding better results when they're treating people in a much earlier stage, meaning if someone is in the very, very early stages and they take some of these medications, they might feel better. They might feel better for a much longer period of time than someone who comes to a doctor well into the disease and says, well, I want some medication for this. That just isn't how it works. So the sooner you can figure out what's going on, the sooner you can get into some trials. The Alzheimer's Association is always looking for people to be in these drug trials and these studies. So that's something that you can think about. The other thing that you can think about is planning ahead. Who do you want to be your caregivers? Who do you want to be circled around you? Do you want to hide away alone and wither away? Or do you want to live life? Do you want to be open about this and still be social? We're finding that the more social people are, the longer they stay with us. If people isolate and they become depressed, the faster the dementia escalates. So there's a lot of advantages to finding out early and facing it early. And it's not always easy. We have a session coming up that talks about coming to terms with a dementia, a diagnosis of dementia. And that will talk more about, you know, those kinds of things as we go along. So that's trying to, just an overview to give you some terms, some language, and there will be other sessions coming up that you can look at more specific things like, you know, what to say to somebody who is living back in their memory and they don't recognize you as who you are, how to interact with them, how to socialize with them anyway, and how important it is for that socialization. Further on down the road, we're going to talk about, as I said, coming to terms with dementia. We're going to be looking a lot more at what's causing it, some things that we have some control over. So you're going to want to check out those topics as well. But that does it for this one. Thank you so much for joining us, and hope to see you again in the future.